Hi there, I'm Dr. Adeleye. I want to talk to you about macrovascular disease and diabetes. And what is diabetes? Diabetes is a lifelong condition that causes a person's blood sugar to be too high. There are two types of diabetics. We have type 1 diabetes and we have type 2 diabetes. Type 1 diabetes is when the body doesn't produce insulin. And type 2 diabetes is when the body doesn't produce enough insulin, or if the body cells doesn't respond to the insulin produced. Type 2 diabetes forms about 90% of patients with diabetes, and the number is increasing worldwide. Dietary and lifestyle modifications have been considered the bedrock of effective diabetes prevention and self-management. There are two major classifications of diabetic complications. We have the microvascular complications and we have the macrovascular complications. Microvascular complications affect the small blood vessels in the body, leading to problems in the eyes, in the kidneys, and in the nerves. But I want to talk to you about macrovascular disease in diabetes. Macrovascular disease is the primary cause of death in patients with diabetes and is 2 to 4 times more likely to occur in diabetes than in the general population. Macrovascular disease is a condition of the large blood vessels in the body through a process called atherosclerosis. And what is atherosclerosis? Atherosclerosis occurs when fat and blood clots build up and stick to the walls of the large vessels, leading to the narrowing of the vessels. There are 3 major types of macrovascular disease. We have the cardiovascular complication, which according to studies has been found to be the leading cause of death in patients with diabetes. And this happens when people have heart attack, which as a result of reduced blood flow to the heart or shortage of or blockage of blood flow to the heart. The other complication is what we call cerebrovascular disease, also known as stroke. And this also happens when there is reduced blood flow to the brain or blockage of blood flow to the brain. And the other complication is what we call peripheral arterial disease. This also happens as a result of shortage of blood flow to the limbs, causing pain, and can also lead to throat ulcers. Type 2 diabetes is closely linked or is closely associated with macrovascular disease in diabetes. So the question is, how do we prevent macrovascular disease? The primary strategy for avoiding complications is prevention. Apart from raised blood sugar, other factors have been found to be associated with macrovascular disease. Factors like smoking, high cholesterol, high blood pressure, and obesity. Obesity is associated with high cholesterol and high blood pressure. And studies have shown that early detection of some of these factors can delay the onset or even the progression of macrovascular disease. Stopping smoking will reduce the chances of macrovascular complication. Reducing cholesterol through healthy living and taking cholesterol lowering tablets, and also regular exercise, which will also lead to weight loss as well. Effective control of some of these factors and reducing the level of glucose level can also reduce the onset and the progression of macrovascular disease. It's been found that macrovascular disease has been associated with patients with diabetes. If you have any further questions or any further clarification, please consult your doctor. Thank you.